And as of today, assessment centers aren't the only locations offering COVID-19 tests. As of today, you can also get swabbed at select few pharmacies in the province. Also today, these pharmacies got a taste of what the demand for testing looks like as they deal with the province's new testing criteria.
Perfect.
As a healthcare worker, Nicholas went to get tested at a pharmacy on Danforth and Coxwell, one of 43 Shoppers Drug Mart locations providing COVID-19 tests starting today.
Let's swap 10 sides. Okay.
It wasn't bad. They didn't go too far in there. I guess it's a new kind of test.
Relieved, he got an appointment within 20 minutes of asking for one.
You call in, you give them your information, and then one of the pharmacists will call you back and give you a screening process, ask a few questions, and then based on that, they'll book you for an appointment.
But not everyone got lucky enough to get through to the pharmacies, as they are required to do to get pre-screened.
I called at 8:30 a.m. Spoke with the pharmacy. They told me that I needed to give them my contact information and then someone would reach out to screen me.
Another viewer who has been calling 3 separate pharmacies since 9:30 a.m. finally heard back 5 hours later and got an appointment for tomorrow. At least one Shoppers Drug Mart location tells us they are booked and their next availability is on Tuesday. The location at Danforth and Coxwell is booking patients 15 minutes apart, limiting the number of people inside the store. But the demand is high. By early this afternoon, they were booked up until Sunday.
The phone just rings constantly, and I think we anticipated that would happen the first few days. We just have to reiterate to patients, this is for people that are asymptomatic, and there are some criteria.
In addition to the 43 Shoppers locations, there are also 6 Rexall stores open today and 4 other pharmacies listed on the province's website. 3 told CityNews they were up and running. But don't expect the same exact swab test they do at assessment centers that goes all the way up your nose. This one is expected to be more comfortable.
We're doing a different type of molecular test. It's looking for the exact same thing, but we swab both nostrils, so it's really at the periphery of the nose, so you don't have this huge device going in.
The province has changed the criteria for who can get tested here. Now it's asymptomatic people who work, reside, or visit high-risk settings such as long-term care homes, homeless shelters, and other congregate settings, as well as individuals who have been identified by healthcare units.
Well, you can't come to a pharmacy if you have symptoms.
This pharmacist has 4 locations and can see this program expanding across the province. At this one store, he has 4 pharmacists in full PPE and says he has enough employees to handle the demand.
We're trying to learn. We want to see how efficient we get at it. We may expand the number of hours that are available as we get a little bit better with the traffic and the workflow. We're asking for some patients from the patients themselves.
So you see these spots are quickly filling up at these pharmacies. The advice from pharmacists, keep calling until you get through. That pharmacist specifically tells me people also come in and leave their phone numbers to get a call back. And the government says up to 60 pharmacies are supposed to be up and running today. There are still a couple that aren't. Ahead on City News, could the program be expanded soon and how booking appointments can change? Pharmacies are helping to alleviate pressure from assessment centers as a select few in the province roll out testing today. Now, out of the 60 who were supposed to offer this service starting today, only 53 have started. The Ontario Pharmacists Association says more pharmacists will be coming on board throughout the weekend and into next week.
There's a lot of preparation and logistics that's going into this. We're offering a lot of support to pharmacies through training module that we have developed, as well as some of the best practices around safety measures and protocols. There's a lot of in-store preparation and then the pre-screening component to assess patients even before they come into a store for the test.
Now, the Ontario Pharmacists Association is speaking with the government about the next wave of pharmacists interested in rolling out testing in regions across the province. Alberta recently expanded testing at pharmacies. The OPA says a third of that province's 1,500 pharmacies are now participating in testing. He is hoping the same happens in Ontario, but the rollout here will depend on which areas are seeing faster increases in cases.
We have over 4,600 healthcare hubs we call pharmacies. So, that decision that a pharmacy will make to opt into this program will be based on a number of criteria, not the least of which will be, do I have the space to do this? Do I have a private room?
The OPA is also paying close attention to what is happening today, particularly with the high demand for testing at pharmacies and the pre-screening process for those looking to come in, which can be time-consuming for the small shops. So they are looking into using technology to help with that.
Trying to use technology, online booking apps that could be on a mobile phone as an example to do some of the pre-screening and self-assessment that will help expedite the discussion with a pharmacist.
Bates also adds that there needs to be more communication, or better communication rather, in place for who can get tested at pharmacies. The province's criteria has changed. It's now applicable to asymptomatic people who work, reside, or visit in high-risk settings, such as long-term care homes, homeless shelters, and other congregate settings, as well as individuals who have been identified by healthcare units. So how soon can we see this program expanded in Ontario? No date for that just yet, but I did ask the OPA how many of their pharmacists are interested. They tell me there are early adopters of the program who are eager to get involved, and then there's a wait-and-see group that is dependent on their own comfort level.